Welcome to Review Central. This is Midwifery Reviewer number 5, featuring questions on infant care and feeding. Although this reviewer is specifically prepared for the Midwifery Licensure Examination given by the Professional Regulation Commission of the Philippines, the concepts are universal and are applicable to similar midwifery licensure exams given in other territories. There are 10 questions featured on this reviewer. All questions are modeled on actual questions that appeared on previous midwifery licensure exams. Now let's begin. Question number 1. An individual from birth to 4 weeks of life. A. Fetus. B. Neonate. C. Infant. D. Toddler. The correct answer is B. A neonate is a baby who is 4 weeks old or younger. The neonatal period is the first 4 weeks of a child's life. It is a time when changes are very rapid. Many critical events can occur in this period. Feeding patterns are established. Bonding between parents and infant begin. The risk for infections that may become more serious are higher. Many birth or congenital defects are first noted. Question number 2. A perfect Silverman score is A. 0 to 3. B. 4 to 6. C. 7 to 8. D. 9 to 10. The correct answer is A. 0 to 3. In order to assess the degree of respiratory distress in neonates, practitioners often use the Silverman-Anderson scoring system. Under this scoring system, the lower the total score, the better the baby's condition is. Normal babies have a cumulative score close to 0. Severely depressed babies score close to 10. Question number 3. A normal Filipino newborn is expected to weigh around A. 2.275 kilograms. B. 2.5 kilograms. C. 3.0 kilograms. D. 3.5 kilograms. The correct answer is C. The average birth weight of a Filipino newborn is 2.8 to 3 kilograms. Question number 4. This is true with regards to the temperature of a neonate at birth. A. Stable at 36 to 37 degrees centigrade. B. Unstable, will stabilize within 8 hours. C. Both A and B. D. Neither A nor B. The correct answer is B. A neonate's temperature at birth is still unstable, but it is expected to stabilize within the next 8 hours. A normal body temperature is 37 degrees Celsius. But in newborns, the temperature may be higher or lower than this. That's because the body usually keeps its temperature within a safe range. But in a newborn, this may not happen for several hours, and in some cases even days or weeks. Question number 5. A normal length at birth of a Filipino infant is A. 15 to 17 inches. B. 17 to 20 inches. C. 21 to 25 inches. D. 26 to 28 inches. The correct answer is B. 17 to 20 inches. A baby's length is measured from the top of their head to the bottom of one of their heels. It's the same as their height, but height is measured standing up, whereas length is measured while your baby is lying down. The average length of Filipino newborns is 17 to 20 inches. Question number 6. An Apgar score 5 minutes after birth will indicate A. Prognosis of the baby. B. Need for resuscitation. C. Both A and B. D. Neither A nor B. The correct answer is C. Both A and B. Introduced by Dr. Virginia Apgar in 1952, the Apgar, or Apgar scoring system, is a quick test performed on a baby at 1 and 5 minutes after birth. The Apgar test is done by a healthcare provider, a doctor, a midwife, or a nurse. The provider examines the baby's breathing effort, heart rate, muscle tone, reflexes, and skin color, in no particular order. Each category is scored with 0, 1, or 2, depending on the observed condition. The 1-minute score determines how well the baby tolerated the birthing process. The 5-minute score tells the healthcare provider how well the baby is doing outside the mother's womb. It also tells the healthcare provider if the baby needs resuscitation. Question number 7. The normal heart rate of the newborn is A. Less than 30 per minute. B. 30 to 60 per minute. C. 120 to 160 per minute. D. 160 to 180 per minute. The correct answer is C. The normal heart rate of the newborn is 120 to 160 per minute, about twice the heart rate of a normal adult. It may be much slower when an infant sleeps. Question number 8. The normal head circumference of the newborn is A. 31 to 32 centimeters. B. 33 to 35 centimeters. C. 39 to 40 centimeters. D. 41 to 46 centimeters. The correct answer is B. The average newborn's head circumference measures about 33 to 35 centimeters, growing to about 38 centimeters by 1 month. Because boys tend to be slightly larger than girls, their heads are larger, though the average difference is less than or just about 1 centimeter. Question number 9. The biggest body part of the baby at birth. A. Head. B. Heart. C. Trunk. D. Extremities. The correct answer is A. At birth, a baby's head is relatively large, making up 1/4 to 1/3 of his or her total body length, while an adult's head makes up just 1/8. Babies have enormous heads in relation to the size of their bodies. As a child gets older and grows taller, the proportions of the body change. The limbs and trunk grow steadily, but the head does not grow much bigger. Question number 10. This condition is not normal in the newborn skin an hour after birth. A. White pinpoint papules on nose and chin. B. Cyanosis of the lips, hand and feet. C. Jaundice. D. Milia. The correct answer is C. Jaundice. Milia is a skin condition in which multiple tiny white bumps or cysts can be seen on a newborn. It is extremely common and most babies will develop these keratin-containing cysts. It requires no treatment as it will usually resolve and disappear naturally. White papule on a baby's nose and chin are actually manifestations of milia, so they are normal and require no treatment. Peripheral cyanosis around the mouth and the extremities is a benign condition and also does not require treatment. Newborn jaundice is not harmful most of the time. For most babies, jaundice will get better without treatment. However, a very high level of bilirubin can damage the brain. If the jaundice is noticeable on a newborn's first day, or if it affects the chest and abdomen, it's a sign that the level of bilirubin may be higher than normal. In this case, the baby should be evaluated by a doctor. You have just completed Midwifery Reviewer number 5, which featured questions on infant care and feeding. If you wish to watch more midwifery reviewers on infant care and feeding, check out our Midwifery Infant Care and Feeding Reviewers playlist. Check out also our other Midwifery Reviewers playlists for other reviewer topics. If you haven't done so yet, please don't forget to subscribe to Review Central and click or press the bell button to make sure you get notified whenever we post a new reviewer or other review materials on this channel. Please like if you find this video useful and feel free to share to anyone who may also benefit from it. We wish you all the best on your forthcoming midwifery licensure exam.